Hello and welcome back to my channel. So in today's video I'm going to be showing you the angle of insertion for injection. There are intramuscular injections, in subcutaneous injections, intravenous injections, and intradermal injections. So I'm going to be starting with the intramuscular injection. So I'm going to try as much as possible to show some pictures as a form of illustration on the screen so you can really understand what I am talking about. Okay, so for intramuscular injection, we give at an angle of 90 degrees. Like, you want that injection to go right into the muscle, so you give that injection, the needle goes right straight into the muscle, so you give it at an angle of 90 degrees. So secondly is the subcutaneous injection. So while administering subcutaneous injections, you give it at an angle of 45 to 90 degrees. Yeah, I said 90 because there are some syringes that comes with a very short and tiny needles just meant for subcutaneous injections, like the insulin needles, the enoxaparin injection needles, or glycine injection needles. These medications are given subcute. I know insulin can be given intramuscular, intravenous, but that needle is majorly for subcutaneous injection because that needle cannot go to the needle even if you give it at an angle of 90 degrees. Okay, so those kind of syringes, they come with needles that are very tiny and short, and they are meant for subcutaneous injections, because even if you give it an angle of 90 degrees, it's still gonna stop at the subcutaneous layer of the skin, so you see end up depositing the medication on the fatty tissues instead of the muscle. Okay, so but if you are using a needle that is long, there's a needle that can go straight to the muscle, while using such needle to administer subcutaneous injections, you have to give it as an angle of 45 degrees. So that is why I said you give subcutaneous injections at an angle of 45 to 90 degrees. So if you are using a long needle, you go in at an angle of 45 degrees so you can get to the fatty tissues. But if you are using a very tiny short needle that is meant for subcutaneous injections alone, you go at an angle of 90 and the needle will stop at the fatty tissue, and that is where you are meant to deposit your injection. This is the intravenous injections. So while giving intravenous injection, or while trying to pass an IV cannula for a patient, you go in at an angle of 15 to 30 degrees, or some people can say at an angle of 25 degrees. So you're trying to get that needle into the blood vessel, the vein, so you go at an angle of 15 to 30 or 25. Okay, that's for intravenous injections. So for intradermal injections, you want the injection to go right under the epidermis. Okay, so this is the epidermis, so right under the epidermis is the dermis. Okay, and this is where you want to deposit your medication. Okay, so you just go right under the skin and you give it at an angle of 10 to 15 degrees. Okay, so have to be sure you are at the dermis. Is while injecting the medication, you will see something like this. It look like wheels on the patient's skin while you are injecting the medication. If you don't see something like that, you may likely be injecting that medication on the subcutaneous layer of the person's skin. Okay, so these are the the angle of insertion for administering injections. Okay, if you like this video, please give it a thumbs up. You can comment if you have any question, and do wait to subscribe to my YouTube channel. Turn on the post notifications so that you can get notified each time I upload a new video. Thank you so much guys for watching, and I will see you in my next one. Bye.